What's up, world? It's Quest Nutrition Network, and we're back again with this second installment on heart disease and heart health. Now, this past February was Heart Health Awareness Month, so I just wanted to start off by reading off some statistics in regards to heart disease. Now, heart disease is the #1 killer in the United States. All right, every 40 seconds, a person is experiencing a stroke. 795,000 people every year in the United States dies of a stroke. In a 24-hour period, 3,000 Americans have a heart attack. And over 40% of African Americans are experiencing high blood pressure. And that's due to things like caffeine, alcohol, salt, and sugar. So these are areas that we definitely have to improve. Now, in the last video, I talked to you guys about a good friend of mine who passed away at the age of 39 years old due to the complications of heart disease. And one of the symptoms he was experiencing was sleep apnea. And sleep apnea is a condition that your breathing is interrupted throughout the night. All right, your breathing passages are blocked. So therefore, your breathing is affected. You basically stop breathing as you're sleeping. You stop breathing for a period of up to 10 seconds. Now, this condition, a person can stop breathing up to 100 times in a night. And what happens is that your brain is deprived of oxygen. And when your brain is deprived of oxygen, you're going to tend to be very tired during the day. Now, if sleep apnea is left untreated, it can lead to diabetes, heart failure, or high blood pressure. Sleep apnea is something that can affect anybody, but it tends to generally be recognized or be seen in men who are over the age of 40, and men who are overweight. So this is another reason why we definitely have to be proactive in the management of our weight. All right. Now, heart disease is known as the silent killer because the symptoms, sometimes a person may not have any symptoms and they catch a massive heart attack. But we do have to recognize when there are symptoms. Now, there are some symptoms for heart disease. There's some symptoms for stroke. There's some symptoms for heart attacks. Generally, when a person is may experience a heart attack, some of the symptoms that you may experience is chest pain, shortness of breath, and excessive sweating. When it comes to a stroke, some of the symptoms that a person may experience is a paralysis in the face, drooping of the face, a numbness. You also may experience chest pain as well, extreme headaches. Also, you may experience cramping in the leg, blurred vision, or dizziness. So these are things that we need to pay attention to. We have to pay attention to these things. And if you're experiencing any of these conditions, you want to make sure that you reach out to your doctor, your emergency room. All right. So basically, what we also want to talk about is what is a heart attack? What is a stroke? All right. When it comes to a heart attack, your arteries that go to your heart, if those arteries are completely blocked, the tissue then dies. And when that tissue dies, that is what is a heart attack. All right. Now, if you have the artery that goes to supply blood to your brain and that is completely blocked, then that is what is known as a stroke. All right. So you want to make sure that your body is getting sufficient amounts of circulation. Now, in regards to nutrition, what can we do in regards to nutrition for heart disease? All right. One of the things that are great that is going to provide our bodies with lots of nutrients are nuts. All right. You want to make sure that you're consuming ample amounts of nuts, such as almonds. Almonds are a powerhouse of nutrients. All right. They contain vitamin E, magnesium, phosphorus, iron, magnesium. Now, magnesium and vitamin E being the most important for heart health. So you want to make sure that you're consuming a lot of magnesium. Now, the next thing I want to talk about is coconut oil. Coconut oil has been in the past recognized as having saturated fat, and saturated fat, of course, not such a good thing for heart health. but the saturated fat that's contained in coconut oil is very important. It's the good saturated fat that will provide the benefits for our heart. So you want to make sure that you're not consuming canola oil or some of these very cheap vegetable oils, because they will do damage to your heart. If you want something that's heart healthy, you need to consume coconut oil. Now, I had talked about this supplement in the last video, and it's called Isotonics OPC3. The reason why I like this is because it contains an ingredient called pycnogenol. Now, pycnogenol has been studied extensively, and it's great for what? Circulation. Circulation is something that you're going to get when you're consuming pycnogenol. And circulation is what is happening with heart disease. Heart disease, of course, as I stated earlier, is when you're not getting circulation of blood going to your brain or to your heart. Now, the circulation also that does not, for men, of course, that circulation that does not go to your groin area, that is, of course, erectile dysfunction. Pycnogenol has been shown in studies to create and allow for circulation in our bodies, in our hearts. So that's why I really like this particular antioxidant. Pycnogenol, of course, is pine bark extract. So you want to make sure that you're consuming ingredients like this. And also water. Water also is very important for regulating blood pressure. So you want to make sure that you're consuming a lot of water. You have to consume half of your body weight in ounces. For example, if you are 150 pounds, you need to consume 75 ounces of water per day. All right. So make sure that you're doing all of these things and some of the things that I mentioned in the last video. So I hope that this video was very beneficial and you got some insight in regards to heart health. So if you have any more questions, please reach out to me at 516-557-5557. My email address is questcnn@gmail.com. That's QUEST@gmail.com. Thanks for tuning in. Take care. Signing out. Peace.